Welcome to the Straight Talk Physio podcast with your host, Dr. Andrew Junak and Dr. Craig Giambattista. On today's episode, we're going to talk about how to optimize your warm-up, why we warm up in the first place, the importance of a cool down, when to static stretch, when to stretch dynamically, and when the best times are to foam roll or use some sort of massage or soft tissue tool. So we're going to get going today with exactly why it is that we warm up and what the point of a warm up is in general. So Craig, you want to get us started?
Sounds good. So a very important topic today. So let's begin with the basics. So why do we warm up? I would say the biggest and most important reason is we just want to get the body ready for what we're going to be doing. So from like a physiological level, we want to increase some blood flow to various muscles. We got to increase our heart rate. And more specifically, we want to prepare our body for the specific movements that we're going to be doing. I would say that's the most basic version of it. Any advice on that one, Drew, or any other ways you kind of describe the warm up or why we do it?
No, I think those are some of the biggest things, increasing blood flow. I think one that's kind of underrated that a lot of times in youth sports I tend to see missed out is preparing the body for specific movements. A lot of times people spend time, maybe stretching out or, maybe doing some high knees, or they kind of do this blended approach of a warm up, but the warm up doesn't actually include what they're about to do. So in the CrossFit world, for example, if you're going to deadlift, you should probably incorporate some sort of deadlift movement, deadlift mechanics, going over form, doing it with a PVC pipe or an unloaded barbell for several repetitions, just so you can get your body ready for movement. I'd say that's probably one of the more underlooked parts of, a warm-up in general is actually getting ready for that specific movement. And then from a cool down standpoint, what do you think is the point of a cool down?
So the point of the cool down is basically just the opposite of what we're doing with the warm up. After you finish your exercise or your activity, your body is kind of ramped up, it's ready to go. And that's not really a state we need to be in for the rest of the day. So the cool down is a nice way to kind of return us back down to baseline. So it does things like decrease heart rate and blood pressure and breathing rate, but we want to do that at like a normal level. There are normal values for that, and we want to kind of titrate it and kind of grade it down. So it's not like when you go to exercise, if you're gonna run, you don't full out sprint, you kind of warm up a little bit and then go after it. And we kind of want to do the same thing when we're on the way down. We don't want to do a bunch of sprints or a bunch of high intensity exercise and then just go back to normal and kind of continue on with the day. We want to help our body out and sort of get those physiological measures kind of back down to baseline at a nice slow rate. And that can do things like help restore like normal muscle tension, when we're talking about muscles, and it can just kind of make you feel better after a workout. I think like a good example would be like, let's say you're running on the treadmill and you're going, you're doing your treadmill intervals or you're doing your 30-minute run. And then as soon as the treadmill stops, you hop right off and, you're walking around, you feel like you're still on the treadmill, and there's some other reasons for that, but that's a kind of a nice, easy example that I think a lot of people relate to that kind of shows the importance of we gotta let our body kind of chill out a little bit.
Yeah. I also think the other important part of it is getting your body back to like that baseline set point and helping alleviate some muscle soreness. I think the cool down can really be used for that versus just, doing a super high intensity workout and then getting to a point where you're just like, all right, I'm done. You just stop. And then without slowly bringing your heart rate and everything else back down, it puts your body in a different state than if you do slowly allow it to work its way back to normal. And then there's a number of different things that you can do to help with that post muscle soreness that you get after a really tough workout as well. We're going to get into that. So, moving forward, we're going to talk about the 3 most common ways that people are stretching, and some of the big things that we can do. So some of the more common things that we hear talked about on social media, that we see in our sports programs and CrossFit gyms, pretty much anywhere in general. We may see people ignore a warm-up period. They just will decide that they're not going to do a warm-up. And in that case, you're kind of mitigating the effects. You're not going to have the best training effect that you could possibly have. But the 3 most common ways that people are stretching nowadays are dynamic stretching, static stretching, and then we're seeing a lot of people doing like foam rolling, or they're kind of mashing out muscle tissue with like different scrapers or Theraguns, things like that. So we're going to get into some of the research on all those different things. So Craig, go ahead and kick us off with dynamic stretching. Tell us, our listeners, a little bit about what it is and kind of what it looks like.
Sure. So dynamic stretching, I would consider kind of like the new kid on the block as far as what everyone's been doing. I think, for years, it's been really common, the whole static stretching. I would say that is when you were, not to say that we're young or old, but when we were in middle school, high school, and we were in gym class, it was all about static stretching. I think now that things have developed and a little more research is coming out, you're tending to see a lot more of this dynamic stretching. And what I mean by dynamic stretching is we're active. So we're not holding one position. We're actively moving around through, a pretty big range of motion. So just an example of this kind of stuff, just if you're kind of like a visual person like me, we're talking like running with high knees, doing butt kicks, doing some trunk rotations, doing walking lunges, whether it be like upper body, some light banded movement, or if we're doing something sports specific, kind of some sports specific movements. Like if you're a runner, kind of working on your takeoff, or if you're playing baseball, throwing, going through the pitching motion kind of deal. Basically, it's just a higher paced movement that uses a larger range of motion. So the biggest thing is, why are we doing it? Like what's even the benefit of this? And I think the number one thing is it prepares the nervous system for higher level activity. That's the big one there. So when we're involved in higher level activity, a lot of things are happening. But one of the big important things is our nervous system kind of keys into this thing called the fight or flight response, which is something that, our listeners may have heard of, but basically our body kind of unconsciously will ramp up the things that are important to us when we're doing high level activity, like our heart rate, paying attention to where our muscles, bones, joints are moving. And then it puts other things like digestion kind of on the background, something we might not need if we are in like a really troublesome, activity. And I think what the dynamic stretching and the dynamic warm up will do is it kind of gets that switch and it kind of turns that dial up and kind of gets us ready for the higher level stuff that we're doing, which I think is very important. From a research aspect, what are we finding? Because that's mainly the key here. And what the research has kind of showed us is that doing these dynamic stretching movements, we can still get an improved muscle length. So getting that feeling of feeling more stretched out, but we're not really going to lose too much of like performance following that. We'll kind of get into that in a second here. So we get the benefit of moving better, so better joint range of motion, and then not really losing out on a lot of performance measures for dynamic activity. And in some case, it can actually improve some performance measures. So I don't know if you have anything to add there, Drew, but I would say the reason that we dynamic stretch, those are the big ones in my mind when people ask me.
Yeah, those are pretty much the big ones that I can come up with as well. When we're talking about the warm-up, we pointed out increased blood flow to muscles, prepare our body for specific movements, prevent injury by warming up, specific activities, then also increasing our heart rate. And that's one of those things that dynamic stretching itself lends itself to doing. So you kind of get everything that you need in the warm-up just from dynamic stretching. So when people always ask me, they say, should I be static stretching? Should I be, having more of an active warm-up? Should I be foam rolling? I think dynamic stretching, hands down, needs to be the number one thing in a warm-up. And that kind of leads us into our next topic that I'll kind of cover here is going to be more so static stretching. Like, why should we not static stretch as part of our warm-up? So what static stretching can do is it places tension on your muscles. So when we're actively warming up, we're just getting more blood flow to them. When we're sitting down and let's say we're holding a hamstring stretch for 30 seconds to a minute, it's not really doing much in terms of blood flow or anything like that. We're not actually moving the muscle through its full range of motion. If we're thinking about a rubber band, we're just placing tension on that rubber band and we're just holding it there. So not much is happening with our heart rate. Not much is happening with blood flow or new blood flow coming to that area of the muscle. Not much is happening as far as preparing ourselves for the movements that we're going to be doing. So the benefits of static stretching, if we think about what the purpose of a warm-up is, it just doesn't match up. However, static stretching has been shown to be great for post-workout. When from a post-workout standpoint, it can help decrease some muscle soreness. It helps to optimize what's called your length-tension relationship in your muscles. So by doing that and placing your muscles on a static stretch after a workout, you might benefit from increases in range of motion. There's lots of research out there trying to figure out how long should you static stretch? Should you hold the stretch for 30 seconds? Should you hold it for a minute? The research is really all over the place. Some of the things that we do know is that if you stretch and you want to make range of motion improvements, you need to be stretching and holding for, upwards of like 2 minutes hold time. And you need to be doing this every day, and it may take months to make a difference. And that's why a lot of times you'll hear different types of coaches tell you like, hey, if we need more motion or more mobility, especially in the CrossFit world, everyone talks about mobility. What we know about that is it takes a long time to get more mobility. It doesn't happen in a week. It doesn't happen in a couple of days. It's something that you need to keep working at, poking into, in order to create a long-term change. Some of the things that we do know about static stretching, when it comes to, from research studies testing it pre-workout, what they found was by static stretching before working out, it actually may hinder your performance when it comes to endurance movements and also explosive movements, because we're actually creating some tissue breakdown. So when I talked about kind of putting that rubber band on tension, we may be causing some slight tears in the muscles, not bad tears, but we're also creating some sort of tissue damage like we would be as if we were working out and using that muscle for a performance specific reason. Craig, do you have anything that you want to add to that with static stretching?
Yeah, I think static stretching, like I said before, just kind of tends to be like the old school way of doing things. And I think that we tend to, because we've seen it, since we've been younger and we've been doing it, then there's like this predisposition to continue it. So typically when I have someone that's not sold on the maybe looking past static stretching, the big thing I'll tell patients to do is, go on YouTube, go on the internet, go on ESPN, check your favorite sports teams and see what they're doing for a warm up. Now with the internet, we have access to all this great information. A lot of high level athletes will put their pre-workout stuff, and you can guarantee that if the professional athletes have trainers with like years of research behind it, all the cutting edge stuff, the top stuff, they're doing the best to perform at their highest level. And I will near guarantee that you're going to see an activity specific dynamic warm-up component in their warm-up program. So if you don't want to trust us, trust the true professionals. Not that we're not professionals, but we you're not going to see us on the pro sports field, but I think that you will definitely see the dynamic activity specific warm-up out there.
Yeah, it's pretty much happening in every single sport. Youth sports hasn't completely switched over. I have started to see some people in at least the Columbus area, they're incorporating more active dynamic things. But a lot of these coaches who do, they're coming from a strength and conditioning background. It's funny because there's some sports that naturally will include more of a sports specific type of warm-up or more of an active warm-up. Like basketball, for example, you always see layup lines. You always see people out there shooting jump shots. Football, it kind of depends, team to team, school to school. Other sports like tennis, you might see a little bit more static stretching. So it really depends on the sport. It depends on the philosophy that the coach may have come from, and just how well they keep up on, the current standards of what we should and shouldn't be doing to help prepare our athletes for performance. And then the last topic that we kind of need to touch on here, and I think this is kind of a deep topic because there's tons of different research out there. There's some people who say, oh, this helps, this doesn't help. But the topic that we're going to hit is foam rolling, and different tools like some of the massage guns or like lacrosse ball smashing tissues, taking scrapers to tissues. to see if that helps. So do you want to get us started on that one, Craig?
Sure. So I think this one is super popular, especially nowadays. Like, if I'm opening Instagram or if I'm on Facebook, and it's obviously just because nowadays ads are tailored directly to you, but you can't scroll too long without seeing one of these like therapy guns going on there, and just kind of seeing they're getting marketed like crazy now. So what's the deal with them? First off, the big thing that I run into is, I guess I can understand why patients and athletes can be a little bit confused as like why it's working. So like I guess the dynamic warm up, it kind of makes sense. Like if you want to, make your stretch yourself out a little bit, like it makes sense to move through a range of motion over and over again to kind of, relax those tissues. Or if we're doing static stretching, if we want to stretch our hamstring out, we can, put our leg up on a chair, bend forward. Okay, I can feel the back of my leg getting tight. That makes sense. Whereas with the foam rolling, it's kind of like, well, this person is pushing on their muscle. How is that supposed to make me any more flexible or make me move better? So I think what we can start out is like the proposed mechanisms of what's going on. So I think that as of right now, I would say we have, just like a lot of stuff we tend to talk about in this podcast, is we have a pretty good guess and we have a lot of great, pretty good reasons why. But can we say for without a doubt this is exactly what's going on? I don't think so. But we'll kind of explain it, and I do think it makes a good bit of sense if we kind of think about what's happening when we're using the foam roller. I like to think about it in two kind of different main subjects here. So what is going on locally, like what's going on mechanically at the tissue, and then what is going on like physiologically, like the whole body system. How's our whole body like reacting to it? So at the tissue level, when we're using the foam roller, when we're pressing the Theragun in there, I think that we have the possibility to maybe reduce some like what we call tissue adhesion. Sometimes if the tissue is tight or damaged or for whatever reason, it kind of develops these small little knots in there, and it can help kind of break those up, which can alter a little bit of kind of stiffness. There's a lot of good sensory receptors in our muscles and our tendons. So sometimes pressing on those receptors can kind of tell the brain like, hey, we got to relax a little bit. As far as like what's happening at like the local level, from more of like a whole body kind of thing, we can kind of provide pressure there. It can increase a little blood flow to the area. It can calm down something called the parasympathetic nervous system, which is basically our unconscious system to tighten things up or relax things, or kind of have like that involuntary effect on us. And it also can like kind of help mitigate maybe the inflammatory response, or even improve like our tolerance to like the pain response just by putting a little bit of pressure on there. So when we do induce like those stretches or quick movements, our body has kind of been like prepared for it, if you will. So as far as mechanisms, Drew, I don't know if there's anything that you tend to educate on. It is like kind of some sciencey stuff, but I think that kind of having an understanding of maybe what's going on can maybe, help figure out why it's working.
Yeah, I think just in general, like most other things, if something's sore, if something's stiff, it helps when you do something to it. Basically taking a foam roll, say your hamstring is sore or tight, you take a foam roll to your hamstring before you work out. It helps it get loose. You might break up some of that muscle tissue a little bit. It'll help increase blood flow to the tissue. So, most people, when I see them foam roll or using like some sort of massage gun or some of these tools, they're doing it to a specific part of their body. They're not usually foam rolling like, their whole upper body, their back, their shoulders, their forearms, their wrists, their ankles. They're usually focusing, probably the most common areas I see are the IT band, the hamstrings, maybe the quads. I'll also see the lats sometimes. So usually these are bigger muscle groups, and these are bigger muscle groups that get sore with the specific movements that they're doing for their sport. So I think, is it useful? Absolutely. From a research-based standpoint, research or not research, kind of the way I look at it is risk versus benefit. If you're going to do anything in general and you kind of have to weigh what the risks are versus the benefits. So if there is potentially some benefit to foam rolling, and the risk of foam rolling of like hurting you or damaging you is like non-existent, then why not do it? So I think foam rolling is great. From a research standpoint, it also talks about how, or research also kind of demonstrates that foam rolling does not necessarily sacrifice performance like static stretching might, if you were to do it beforehand. And there's some decent research out there that shows that it alleviates muscle soreness after you work out. So from a foam rolling standpoint, you kind of have a little bit more flexibility with when you foam roll versus when you should static stretch versus, do dynamic stretching. You can, in theory, you can foam roll before and after you work out, and still gain some sort of benefit from it. Whereas, you're probably better off, being a little bit more specific with how you use static and dynamic stretching. And then kind of, I guess, like on top of that, when you really start to look at what helps to improve performance, muscle length or having more mobility is not always the key to more or to better performance. I'm going to use one quick example here that I always like to give patients, where sometimes muscle or tendon stiffness is actually beneficial. In the case of professional basketball players, like NBA players, a lot of times having a stiffer Achilles tendon or stiffer ankles is actually more beneficial, because you can generate and store more power within your tendon to create a better vertical jump or a little bit more rebound, maybe a quicker first step. So usually, or kind of in theory, we don't actually stretch pro basketball players into like a higher level of dorsiflexion or get them more ankle mobility at all times, because they just don't need it. And it actually is beneficial for them to be a little bit more stiff in that specific spot. Whereas in CrossFit, I mean, if I haven't met a single coach that doesn't talk about ankle mobility and does not have people doing banded ankle mobility up against the rig so that people can, get to the very bottom of their squat past parallel. Whereas in a sport like basketball, you don't really need to squat past parallel, because you don't do anything in those positions. There's no movement standards that tell you need to go that low. When we jump, we never jump. I don't even think 90% of the time when we make even a 2-foot gather jump, we don't actually hit parallel. We probably break about 45 to 60 degrees of hip range of motion. So we don't even need to go that deep to maximize our jumping potential. So not every sport requires a lot of range of motion for us to achieve optimal performance or great results. Do you have anything to add to that?
I think you hit on something really great there. And this is a kind of a talk I'll have with a lot of my patients is everybody moves differently. And your goal, whether it be warm up, corrective, exercise, whatever, is to optimize your movement and kind of move in a way that you can move, right? So like you said, not everybody has to have all this crazy range of motion to do all their tasks, but you as a person, you as a patient need to have the right range of motion to do what you want to do. So a good example would be like if somebody was a ballerina, they would need to have a crazy amount of like hip rotation versus if you were just, in your mid 60s and you just wanted to get back into just living a healthy lifestyle, you need way less range of motion to complete, let's just say like a goblet squat or just a weighted squat just to make your legs a little bit stronger. A lot of people I see tend to equate like mobility to overall health. Like many times in the clinic, I'll have somebody that comes in with like hip pain or knee pain or ankle pain, back pain, you name it. And just as like a general screen, just to kind of see how they're moving, I'll say, well, let's try, bend forward and touch your toes. They bend forward, they can't touch their toes. And they're like, you know what? I knew I was getting weak. I got to work on my flexibility, when in reality, that's just maybe kind of how they move. And I think that we have kind of somewhere in our lifetime have put this like major importance on like the amount of mobility and overall like health and physical well-being. Now, of course, like you need to have like the right mobility to do regular things, Like there is a correlation between a lack of mobility and pain on like the other end of, on the extremes. But the average person not participating in any high level activity, but just wanting to do their regular things, I would say muscle length maybe isn't important as we think. And I think that's kind of a big takeaway there. The example I like to use is like, if we think of how where we get our motion, right? So from the very bottom, we have the two pieces of bone together making the joint. There is a certain amount of movement that joint allows. We can't change that, right? That's just structural.
That's your anatomy.
That's kind of how we have it. There's a capsule around that joint. So there's some ligaments going on there. Ligaments are non-contractile, so we can stretch them and move them, but we can't really change them too much. So that can limit a little mobility.
Unless we tear them.
Unless we tear them. Of course. We can always take it out there. Which
that's one way we can change them, but we don't actually want to change them.
Yes. Which hopefully we're not doing that. But yeah, technically correct. We can absolutely change them in that respect. And then lastly, we have our muscle tissue and our tendon, right? So that's something I think people get hung up on because that's something we can change, right? So if somebody is stiff, they're like, I need to make my muscle longer. When in reality, if you think of what a muscle basically is, it's little building blocks connected together. So links in a chain, right? And physiologically speaking, we can't add links to the chain. We could take links away and the links can get a little closer and they could tighten up, but we can't add links to it. Right. So I try to educate patients that we can like cause the nervous system to maybe relax the chain a little bit and get a little bit more mobility. But like you said earlier, it's not like we're going to cause the muscle to actually itself get longer. So I don't know if you run into any of that kind of stuff. You tend to work on the higher level population. So as far as like education wise, like what are you saying out there? What are you kind of telling these people?
So it's great that you brought that up. Is that I didn't think we were going to go this route, but this is great. I do a hip mobility workshop, hip mobility and squat depth, and I go through the structure and anatomy of your hip joint because there's a theory, or not a theory, but there's essentially a concept of anteversion and retroversion, which are the angles at which your hips kind of sit within your hip joint socket, and that angle changes how much mobility your hip can actually have in general, because that's just the structure of your bones. So we have more limitations than just tight muscles. Sometimes our anatomy just doesn't allow us to get into certain positions. And at some point we have to accept that that's just how we're made. So when people say like, oh, I'm stiff or I'm tight, and then they say, oh, what are some good stretches for me to get into this position? It's a lot more complex than that, because if the problem is your anatomy, well, you're just not going to get into that position. If the problem is, a muscle length issue, yeah, you might be able to get into that position, but it's going to take you a while. If the problem is, a tight joint capsule, then there's some things that need to be done to help loosen that up. So each of these require different fixes for you to get into those specific positions. And the other point I wanted to touch on too, that you had mentioned is, about having tons and tons of mobility not always being the best thing. And sometimes people try to measure their health based on how mobile or flexible their joints are. I would take gymnasts or gymnastics as a sport where you're required to have a lot of mobility. However, more mobility does not change your injury rate. Gymnasts are injured very, very regularly. Now, some of that is due to the nature of the sport. They're doing very high level flips and, they're transitioning like on high bars from one bar to another, and they're falling from different heights. But at the same time, usually from a gymnastics standpoint, many gymnasts have overuse injuries. And a lot of those overuse injuries are actually stemming from a weakness in the muscle itself. When your joint has so much range of motion or so much ability to move, you have less strength within those specific ranges. So in order to prevent injury, you actually need to be strong in those ranges or extreme ranges of motion that you have. So sometimes the more motion you have, the harder it is to maintain like your joint stability or the strength around your joints.
Yeah, I agree completely. And I know we kind of, segued there a little bit, but I think that, circling back, it is important to talk about that stuff because the whole point of the warm up, just kind of taking this full circle, like we talked about earlier, is we want to take what we have and we want to be able to move in it the best way possible.
Yeah, absolutely. So what are, all that being said, when should we be foam rolling or smashing tissues? When should we be dynamic stretching? When should we be static stretching? Like, after all this, what is our takeaway for the listeners? What should they be able to conclude or put together from all of this? When is the best time to optimize their warm up? What should we be doing?
Right. So key takeaways as far as the dynamic stretching is concerned, I would do that pre-exercise. Like we said, it is a
Hands
good
down.
way to get the body ready for what you're doing. And I think that we should make it activity specific. So kind of close to what you're trying to do, but just at a much lower level. As far as static stretching is concerned, if I had to pick a time to do it, post-exercise wouldn't be the worst time to do it. That's not to say you can kind of toss some static stretching in wherever you see fit, but I would not make that the mainstay for, let's say, your pre-exercise routine. And finally, with the foam rolling, as far as the current evidence is concerned, I think you can do it before and after. Just realize what you're doing it for. Foam rolling before exercise is a nice way to gain a little bit of mobility while not inhibiting muscle performance, whereas foam rolling after exercise might be a good way to decrease some exercise soreness. But the main takeaway is that we should be doing some sort of activity-specific mobility geared to what's coming up next. Anything to add there, Drew?
Yeah, I think the biggest thing that you mentioned is dynamic pre-exercise, static post-exercise, and then foam rolling before or after exercise. The one other thing that I'd like to add to this is you shouldn't foam roll in place of dynamic stretching or in place of static stretching.
Yeah, that's great point. Great point.
I think that, having foam rolling is like something, think of that as an adjunct. I think the two things that we know the most about from a research standpoint are dynamic stretching pre-workout and then static stretching post-workout. Foam rolling we know that it's beneficial. We don't know all the mechanisms as to why it works, but I think that's something that should be sprinkled in, but should not take the place of the other two at those times.
Yeah, perfect.
Anything else with that, Craig?
No, I think you knocked it out of the park there, and that's the exact information and advice I would give.
Awesome. All right, guys. Well, that concludes our episode today. Thank you for tuning into the Straight Talk Physio podcast. If you like what you're hearing, it would mean the world to us if you subscribe to this podcast and the Peak Physiotherapy and Performance YouTube channel. For more information about us, check us out on Facebook at Peak Physiotherapy and Performance and on Instagram at P3 Physiotherapy. For more information about Craig, you can follow him at Dr. Craig _PT on Twitter and Instagram. If you have any topic suggestions, comments, or questions, then feel free to email us at thestraighttalkphysiopodcast@gmail.com. Thanks again for watching, and we hope you have an awesome day.